Hafide, and welcome to another episode of My Story. My name is Michelle Sasamoto. Today we're going to be talking with some individuals from the Guam Cancer Registry. We're going to be taking a look at what the data profile in Guam looks like surrounding cancer, what that information is used for, and how people can get that information so they could be able to provide further services and programs on our island. Thank you for joining us. Hafide, and welcome back to another episode of My Story. My name is Michelle Sasamoto, and I am your host. Today we have in studio special guests Naomi Del Mundo and Renata Brodalio from the Guam Cancer Registry. Welcome, ladies.
Thank you for having us.
Could you please tell us a little bit about what the Guam Cancer Registry is? Tell us your role within the organization and what purpose.
Okay, so I'm a data collection specialist with the Guam Cancer Registry and also certified tumor registrar.
I'm also a data collection specialist and a certified tumor registrar as well.
And so the purpose of the registry is to collect island-wide data, cancer data for residents of Guam, basic incidents, that means the number of cases, and mortality data so that we can view this problem and know the facts about how much cancer there is in Guam, and so that this data can be of help to policymakers, planners, and programmers.
Right. Well, thank you so much for joining us. What kind of data is collected by the Guam Cancer Registry? And does it include like the different types of cancers as well?
Yes. So we collect patient demographics, the type of cancer they have, the date, the year that they were diagnosed, if they're still alive and living, and when their last date of contact with a facility or with us.
I see.
Yes. And we follow national standards, so there is a set of cancers that are nationally reportable. So all cancers really that are malignant, we collect all types of cancers, and there's so many different cancer types. We also collect brain tumors. They don't have to be cancerous, but if there are any brain tumors or central nervous system tumors, we collect that. And so that is all. Those are the nationally reported cancers. And then each cancer registry, we have the freedom to collect cancers or tumors that we're more interested in that might not be nationally reportable. So for the Pacific Island jurisdictions, we've decided, for example, cervical cancer is very high in our region, and it's not so high in the United States, but it's a big problem in Micronesia and Guam. So we collect not only cervical cancer, but pre-cervical cancer. It's called, the short name is SIN3, and we collect that, whereas other registries don't.
I see. And so, with all this data, it seems like there's a lot of information that's being collected. Is there like a certain method, maybe partners involved in bringing this data to the Guam Cancer Registry?
So all medical facilities and non-medical, meaning insurance companies, nonprofits, anyone that render services to cancer patients have to report to us any data that they collect. So with medical facilities, whether it's radiological reports, pathology reports, they have to submit that data to us. So there's two forms of case collection that we do, active and passive case collection. Passive case collection is when these facilities give us a patient listing or the actual document of the patient directly to us, or if we feel like we're missing certain information from these patients, that we go out to the facilities ourselves and collect it ourselves.
So if the data collection is not enough or sufficient based on what is just reportable, then the active part is when you go out and you get more information?
Yes.
I see. And I always like to say, if the viewer is watching today and we talk about data, sometimes that could be, it's like, what is that? What does that mean? And a lot of times I know it's, math would tell us that data is statistics and it's also numbers. But I feel like numbers and everything that you're talking about is always connected to a story, because the numbers that you have collected is somebody's loved one, right? Mother, father, sister, brother, husband, wife, child. So that's very important. when you're able to collect all this data, and now that you have nicely put it together, and I see you've brought some of your data reports, how do you get that to the public and all the people and the organizations you mentioned earlier, like the policymakers, and just so that it could drive some of the programs? How do you disseminate that information?
Okay, well, I'll just show you 2 examples of our what we call Guam Cancer Facts and Figures. And again, other states, they provide their own, like Hawaii has its Hawaii Cancer Facts and Figures, right? And so we actually put together 5-year groupings of cancer data, because when we get into statistics, you need a large number of cases to have really reliable statistics. So that's why we group them in 5 years. And this only comes out every 5 or 6 years. So, but this has a really detailed data. Like, again, the cancers are broken down by cancer type, by gender, by ethnicity, by age. Now, you know, other than, and for example, this one here is for all of the Pacific Island registries, the U.S. affiliated Pacific Island registries, because there are registries all throughout the Pacific. And we'll get more into that later. But I'm getting lost with my question.
No, that's okay. So I hear you say that, like, so we have the local data, then you also mentioned the U.S. affiliated Pacific Islands, right? With that data, and also data is collected annually, but then yet it's published on a 5-year period. So it's important to just ensure that all that data is continuously collected on a year-to-year basis. Let's talk a little bit about the Pacific Regional Central Cancer Registry. That's a mouthful. And how is that relatable, or what is like the affiliation with the Guam Cancer Registry?
So a Pacific Registry is what you would say like our last quality control assurance step before they submit the data to CDC, because that's who we report to. So all the Pacific Island jurisdictions submit their information or their cases to the Pacific Registry for final editing and review to make sure there are no duplicates, there are no conflicting information and whatnot. So we have the best information, best data that we have.
So they also serve like quality control,
Yes.
right? And just to ensure that standards are kept to where it needs to be. You're talking about the Pacific Islands, and sometimes I know just based on geography what those are, but could you share with the audience who is included with this Pacific Island, the Pacific Island Registry?
Okay, so we say U.S. affiliated because they're all, again, affiliated with the U.S., right? U.S. affiliated Pacific Island jurisdictions. So that includes American Samoa, and then of course there's Guam. There's a Commonwealth of the Northern Mariana Islands, CNMI. There's a Republic of Palau, Republic of the Marshalls, and then there's Federated States of Micronesia, which includes Chuk, Yap, Kosrae, and Pohnpei.
Oh, and all those ethnic groups they're pretty much on the island. We have, there are brothers and sisters that live here as well. So it's a good capture that we can collect that locally. And then we also have the Pacific region to ensure that all that data is just really nicely put together.
Actually, those islands have their own registries. And just like Guam, we only collect data for Guam residents. Those registries, each of those Pacific Island jurisdictions, they collect their own data. And all our registries, we all own our own data.
Yes.
And then we send it to Pacific Regional Central Cancer Registry, and then they collect that data and send it on to CDC.
And of
Centers for Disease
course,
Control.
then the ethnicities that are living on the island, that's collected with our Guam numbers as well.
Yes.
Right? So it's represented here. Wonderful. So why is it important to collect local data and regional data as well?
Well, the data that we provide helps policymakers with certain platforms and bills and laws, such as the tobacco tax. So we see an increase of lung cancer in Guam. We have one of the highest rates of all of the U.S. So the increase in tobacco tax will hopefully lower our chances with lung cancer here in Guam. It helps with student research and educators. For example, we've had betel nut studies where it's related to oral cancer, the liver cancer as well in relation to betel nut. And yeah, it's just helping us, helping us to see what other factors there could be specifically to Guam in relation to cancer.
Right, and I know you talked about the betel nut, and if my memory serves me correctly, just recently you had some interviews or you were calling for people to do like a betel nut study.
Yes.
Is that part of the cancer registry?
It's part of the Guam Cancer Research Center.
Okay, I see.
So the Cancer Registry is part of the Guam Cancer Research Center, which is located at the University of Guam. And we're actually all in the same area, Dean Circle. We're in House 7, and the research center's in House 7 and House 27. And so, there are a lot of different research programs, and one of the ongoing ones has to do with betel nut and liver cancer.
I see. Yeah. and-
Because liver cancer is rising. It's rising on Guam, and it's also rising in the U.S.
I know. So with that, it kind of just brings me back to what you said earlier, that even if there's national standards on data that needs to be collected, sometimes we have to be a little bit more specific. And, I'm sure that betel nut, they don't collect that kind of information maybe like in rural Kentucky or, somewhere in the United States. And it's very pertinent to our island. So thank you for sharing that. So with all of this information, like if people just wanted like a website to get that resource with the publication, is there a website that you go to, or is there somewhere that they can call?
Yes, a very easy to remember website is www.pacificcancer.org, all lowercase. So it's www.pacificcancer.org, and that has information. Basically, it's a Pacific Regional Central Cancer Registry website, and has information about cancer from all the islands. Okay. It's a great resource.
Wonderful. When we return, Limona Suswiko will be joining us in studio. Please stay tuned. Welcome back to My Story. Earlier we had in studio Renata Naomi from the Guam Cancer Registry, and we were talking a little bit about how data was collected and all the pertinent information around cancer on Guam and also in the Pacific Islands. Joining us now, we have Limona Suswiko, who is also from the same office. Limona, could you please tell us a little bit about your role and also what you do with the Guam Cancer Registry?
Okay, so I'm a data collection specialist with the Guam Cancer Registry. I pretty much do the same as Naomi and Renata. And on top of that, I also assist with the Pacific Regional Central Cancer Registry, preparing the data for final submission to CDC.
So again, you have one of the bigger jobs too, to just ensure that all that data is collected. Thank you for joining us today.
Thank you for having me.
So earlier, Renata, we were talking about some of the data the types of data that's collected, the importance. We've also talked about like the methodology and the data collection and the dissemination. It has to come from somewhere, right? There's got to be some resources and funding sources to ensure that that continues on. Could you tell us a little bit about what are some of those funding resources to ensure the data is collected and disseminated?
I can answer that. The Guam Cancer Registry is funded locally through the tobacco taxes via the Healthy Futures Fund. That is for the Guam Cancer Registry. The Pacific Regional Central Cancer Registry is federally funded through the University of Hawaii through grants with the NIH and the CDC.
So is that like a standing, like funding that just comes continuously?
Yes.
That's always reserved for this purpose?
Yes.
With the Purser grant, it's a 5-year grant. So I'm not, honestly, I think we might be in year 3 of the Purser grant. I'm not quite sure, but every 5 years they have to resubmit again, reapply for the grant. Luckily, we've had it for several, 5-year periods. We're so lucky with the Guam Cancer Registry. We used to be dependent on federal grants also, but now, thank you, Guam Legislature, we have that 1% funding from the tobacco taxes. So we're basically, we can rely on that funding every year.
Yeah, that's reassuring to know, right? Because again, it's like we collect all this rich data and it's very helpful. So there's got to be some type of sustainability. So I'm very happy that our local government is playing a really integral part in that. So thank you for sharing that with us. With the data that you've collected, could you share with us the top 5 cancers that are here on island? And have you seen different trends throughout the years that you've been collecting this data?
Okay, well, it's really amazingly stable because from the very beginning, okay, right now, the top 5 cancers for Guam, in terms of incidence, that's the number of cases and also mortality, are lung and bronchus. Lung is always number 1, breast, colon and rectum, prostate, and liver cancer. And okay, for Guam males, it's prostate, lung, colon, liver, and leukemia. For Guam females, it's breast, lung, colon, thyroid, and uterus. Basically, this follows the same pattern as the US. The top 3 are always lung, breast, and prostate cancer.
So it's the same thing for the United States.
Yes, and colon cancer. And again, cervical cancer is not in the top 5 for Guam, but it's like perhaps the 6th or 7th for Guam women. And it's, like I said, cervical cancer isn't a big problem in the States, but it is a big problem on Guam and in Micronesia, so we pay special attention to that.
Do you see that also trending with the Pacific jurisdictions, with the U.S. affiliated islands?
Yes, cervical cancer. All these cancers that I spoke about are also the top cancers in the PIJ. Cervical cancer would be much higher up for the rest of Micronesia. And all these cancers, I just want to say, have testing so that there's there are diagnostic tests for them. And that's why cervical cancer in the States is not a problem, because they have pap smears. It's just that here in the islands, we're very lucky in Guam. We have a lot of resources in Guam. We have clinics, oncologists, we have radiation now where we didn't used to have before. But in a lot of the other islands, some of them don't even have mammograms or a way to test or pap smears. They're very resource poor, a lot of the islands. And so again, we're very lucky in Guam. We have a lot more services, but throughout Micronesia, it's very difficult for them to obtain care.
Do you see that could impact in terms of difference in maybe early on detecting cancer and then providing services and treatment for individuals with the limited resources?
Yes, definitely. There's also the cultural attitudes, and even in Guam, I mean, even though I work with cancer, I have a fear of cancer. Sometimes I delay my testing. So there's also the cultural attitudes, and they differ, throughout the region with the different cultures in Micronesia, and so we're just trying to we're really trying to emphasize early testing, because cancer it's not a death sentence. It can be a curable disease. Many cancers are curable.
Yes, and again, interesting that you say what you said, because it really is one of those things where we want to give rich advice to people we love, but sometimes it's difficult for us to kind of take that on our own as well. What would you say to people? I mean, thank you for being so vulnerable on camera and saying that even if you work with this information and with this topic, with cancer per se, it's still a very scary thing as an individual, or maybe even for our family members. What type of assurances would you tell the audience just to ensure that they do go get that routine checkup so they can be detected through screening?
Like you said, prevention is the key. That's pretty much what I would say is, if you can and you have the ability to go get tested, do so, because if you catch it early, you're better off.
Yeah.
And even for people, let's say people who aren't working or don't have, good insurance, there are places like it's a long name of an agency, but the Guam Breast and Cervical Cancer Early Detection Program. That's a national program, and it also exists on Guam through public health. So women who want help with cervical cancer testing or breast cancer testing, they can go to that program under public health and get tested without any insurance.
Wonderful. Or can they call your office as well too, or just like the different resources around cancer? I know you mentioned an organization earlier.
Guam Cancer Coalition.
Guam Cancer Coalition. Is that also another resource that the community can use to get more information that is a little bit more relevant to whatever conditions they are dealing with?
Yes, Guam Cancer Coalition also publishes a small publication called the Passport, the Guam Passport, and it has resources, available, all the phone numbers, all the relevant numbers and organizations that you might need if you are a cancer patient or family of a cancer patient.
So, I know that Guam, right, when and you talked about a little bit about the Pacific Islands and some of their limited resources. Guam, just from what you are talking about, we are pretty resourceful. We have a wealth of resources on the island, and I think it's just getting that information out to people that's really important so that they know that there's places that they can basically access and, get the services provided to them. Are there anything that you want to just talk about, like any trends or messages, just through your experience working with the Guam Cancer Registry, that you might just want to share with our family and friends here on the island, or those watching?
For me, just with my time at the Guam Cancer Registry, I found that data is very important. If you want to get the good statistics out there, the better data that we have to put into our system produces better data for us to provide out to the general public. So quality cancer data saves lives is what we say.
Yes, so we would like to ask all our mandated reporters. I know it's very difficult in the clinics; they're so overworked. But we want to thank you, first of all, to the clinics that allow us to come in and get the data, and the clinics that send us data, even though we haven't. We do send out reminder letters, but there's some clinics that are just so great. They send us their data on time, and the others might need a little prodding. But I'll tell you, when we talk to cancer providers, they're very cooperative. They just want to. Sometimes we have to remind them how to send us the data, when to send us the data. And we really want to tell people that all these top cancers do have testing, ways of testing for it. You catch a cancer early. There's, cancer treatment has really advanced in the last, 10 years or so. And even for lung cancer, which was, thought to be always incurable, there are better testing methods for lung cancer. So please see your doctor and get tested.
Yes.
And if you want any information, you can call the Guam Cancer Registry. Again, we don't provide direct services. That's one thing we need to let the public know. We're basically like a big database, right? But you can still call us, and we can give you the numbers to other cancer organizations that do provide direct services. And our phone number is 735-2988 or 735-2988 or 2989.
Thank you, ladies, for joining us, for just giving us all that information and making it make sense. Data is just not a number, right? Data is not just stuff that we collect and we put on our shelves. And how you just painted everything for us today was that it's so useful. It basically tells a story. It tells the story of our loved ones that are inflicted with this condition, with this issue. Not only does it help the individuals that are doing the research and the policymakers that are also out there trying to get some funds and monies to be able to provide programs and services for individuals that are affected by this, but it just basically is a hopeful message that, like you said earlier, Renata, it's not a death sentence, and you guys really put a lot of light on today, and I really appreciate that if you go in and we take that first step and be courageous, because we tell our family members to do the same thing, but just doing that, taking that first step could save our lives. So thank you again for joining us.
Thank you very much for giving us the opportunity.
Absolutely. So thank you so much, everyone, for joining us. Thank you for joining us for My Story. We'll see you at the next episode.